Hello everyone, welcome to MBBS classes. In this video, we'll discuss about anatomy of external ear, and in this video, we'll confine our topic to auricle. External ear is composed of two components. As you can see here in this diagram, this is pinna or the auricle. The auricle or the pinna is attached to the side of the lateral part of the head by the muscles and ligaments. And the second component of external ear is external auditory meatus. The external auditory meatus, it is in continuation with the pinna, which starts at the concha and it is up to the tympanic membrane. Now let's see about the auricle. Auricle or the pinna, it has two surfaces. One is the lateral surface. This is the lateral surface which is facing outwards, or it is also sometimes called as anterior surface. On this lateral surface, we get ridges and depressions. And there are certain nomenclatures we'll discuss. The second surface is the medial surface, that is the backside of the pinna, which is facing the temporal region. So the pinna has two surfaces. One is the lateral surface, which is facing anteriorly, and the medial surface, which is facing posteriorly. So what are the ridges and depressions? The outermost largest rim is the helix. As you can see in this figure, it starts from here, the crux, then it turns in a curve-like manner, and it ends up in a soft tissue part which is called as lobule. There is another triangular type of projection in the interior part of the external auditory canal, which is called as tragus. Just opposite to the tragus, there is another small projection which is facing opposite to the tragus here. This is the antitragus. This part, a small another parallel line running to the helix is known as antihelix. The depression in the ear, this part is known as concha, which is the starting point of the external auditory meatus. I have highlighted one point here, one anatomical area of clinical importance, that is the incisura terminalis. There is some importance of the incisura terminalis. It lies between the tragus and the starting point of the helix. In this incisura terminalis, the cartilage is dehiscent here, and the importance we'll discuss later on. So, what is the normal position of auricle? So, to define the auricle, there are certain anatomical relationships. It comes into help when we are doing the clinical examination of a patient. In the examination of ear, the first thing which we have to notice is the shape and position of the auricle. So, how to define a normal ear? A normal ear is defined in 5 anatomical relationships. The first is the line of balance. The line of balance is defined as an axis through the largest diameter of the auricle. If you see here, this is the largest diameter of the auricle. So this line in a normal ear, this line of balance, then it makes an angle of about 20 degree from the vertical line. If we draw an imaginary line from here and another line through the largest diameter of the auricle, for a normal ear, this angulation should be 20 degree. Next thing which we have to take into account is the height of the auricle. In adults, the average height of the pinna is approximately around 6 cm, whereas in infants it is 5 cm. So whenever we are doing clinical examination, just we have to assess approximately the height of the auricle by inspection. One thing I would like to emphasize is that in children, in infants, the height is around 5 centimeter, and by 5 years of age, the cartilaginous development is over by 5 years of age. So the height reaches its maximum size by the age of 5 years. Next thing which we have to take into account for defining a normal position of auricle is the relation between the width of the auricle and the height of the auricle. The normal auricular width should be approximately 55% of the height of the auricle. Next point which is taken into the account while defining the position is the auriculomastoid angle. This is the auriculomastoid angle, which is an angle between the auricle and the mastoid region, which we can see in this posterior view. This is the frontal view, this is the lateral view, this is the posterior view. So when we examine the patient, the angle between the auricle and the mastoid in a normal position of the ear, it is usually between 15 to 30 degree. So if this angle is more than 30 degree, then it is known as protruded ear. Next thing, the last thing which is taken into account is the distance between this helical rim and the temporal region. So approximately the distance between this helical rim and the temporal region, it should be around 15 to 20 mm. That is nearly about 2 centimeter. So to define a normal position, the points which has to be noted into account, first is the line of balance, this one. Second is the height of the auricle. Third is the auricular width and the height ratio. Next is the auriculomastoid angle. And last is the distance between the helical rim and the temporal region. Now let's see what constitutes the framework of the pinna. Pinna is basically formed by, the basic structure is formed by the cartilage. That is the auricular cartilage. It is an yellow elastic cartilage which is covered by skin. But the whole of the pinna is not formed by auricular cartilage. There are certain places where the cartilage is dehiscent. I repeat, there are two places in the auricle where the cartilage is dehiscent. The first is the site of incisura terminalis, which I have already described in the first slide. The second area where the cartilage is dehiscent is in the lower part, that is in the soft tissue part, that is called as lobule. So just remember that in two areas of the human pinna, the cartilage is dehiscent. The first is at the lobule and the second is at the incisura terminalis. The average thickness of a cartilage is around 0.5 to 1 mm. This cartilage is attached to the skull by ligaments and by muscles. As you can see in this figure, these are the internal intrinsic group of muscles which runs through the cartilage, and second group of muscles, these are the extrinsic muscles which connects the cartilage to the side of the head. From where it gets its nutrition? Any cartilage, it gets its nutrition from its overlying perichondrium. This is important clinically. I repeat that cartilage gets its nutrition from its overlying perichondrium. In the pinna, this cartilage is covered by a layer of skin. So what are the muscles which help in anchoring the auricle to the lateral part of the head? The muscles are in two groups. The first group is the intrinsic muscle, which passes through the cartilage of the auricle. This is the cartilage of the auricle, and the muscles, they just pass through the cartilage. The second group of muscle is the external muscle, which anchor the cartilaginous framework to the side of the head. So what are the muscles? The muscles are: number one, this is the anterior auricular muscle. Number two, this is the superior auricular muscle, and this is the posterior auricular muscle. This anterior auricular muscle, along with the anterior ligament, it helps in anchoring the tragus and the anterior helix to the zygomatic process. This posterior auricular muscle, along with the ligaments, it helps in anchoring the concha to the mastoid area. So remember, there are two groups of muscles, intrinsic and extrinsic. Now let's see what is the characteristic of this covering of the cartilage, that is the skin of the cartilage. The epithelium, as similar to the epithelium of the other parts of the body, this epithelium is keratinizing squamous epithelium. But it has certain differences, that here in this auricle area, the subcutaneous layer is thin. It is not as thick as other part of the body. This is important because due to this thin layer of the subcutaneous layer, the vessels are in relatively exposed state, which makes them vulnerable in any sort of frostbite. Second thing which is important is that, which you should know, that in this is the area where the adipose tissue is only found in the ear. The other things, where other structures which are found are the hairs, as you can see, hairs, and the glands, that is the pilosebaceous glands. Now let's see the blood supply of the auricle. The auricle or the pinna, it gets its blood supply from the branches of the external carotid artery. If you see here, this is the lateral surface. The lateral surface, it gets its blood supply from the anterior temporal artery. This is the anterior temporal artery, which is a branch of superficial temporal artery. This is superficial temporal artery. It is giving a branch, anterior temporal artery, and it is supplying the lateral surface of the pinna. Remember, anterior temporal artery, it supplies the lateral surface. Then the medial surface or the posterior surface is supplied by posterior auricular artery. Respectively, the veins, they follow the arteries and they drain into superficial temporal vein and the posterior auricular vein, and ultimately they drain into internal jugular vein. So where the lymphatics drain from the auricle? The anterior part or the lateral of the lateral surface of the pinna, they drain into the parotid nodes. Remember, so the anterior part or the lateral surface, they drain into the parotid nodes. The medial surface, or you can say the posterior surface, they drain into the retroauricular nodes or mastoid nodes. The other group of nodes which sometimes may be involved are the upper cervical nodes if the infection or if there is any pathology in the lower part of the pinna. So there are three group of lymph node drainage: parotid nodes, that is anteriorly from the anterior part or the lateral surface; retroauricular node is from the medial surface or the posterior surface; and from the inferior part they drain into the upper cervical nodes. Now let's see the nerve supply of the auricle. Ear is one small area, but it gets its nervous innervation from the multiple nerves. If you look into the diagram here, we can see here the greater auricular nerve, the auricular temporal nerve, this auricular branch of vagus nerve. So On the lateral surface of the pinna, this is the lateral surface. How we identify? We identify by ridges and depressions. So on the lateral surface, the lower third of the lateral surface is supplied by greater auricular nerve, that is the C2, C3 nerve. The upper part of the lateral surface is supplied by auriculotemporal nerve, which is a branch of mandibular division of trigeminal nerve. A certain part of the concha and the tragus area, this is the concha and the tragus area, it gets its nerve supply from the auricular branch of vagus nerve, which is also known as Arnold's nerve, and also it sometimes gets from the ninth nerve. So on the lateral surface, let's memorize the lower one third of the lateral surface of the pinna is supplied by greater auricular nerve. The rest of the auricular part is supplied by the auriculotemporal nerve, which is a branch of mandibular division of fifth nerve. So it is the fifth nerve in the upper part. In the center or in the concha, it gets its blood supply and nerve supply from the vagus nerve. Now let's see what is the nervous innervation on the medial surface. The nerve innervation on the medial surface, the lower two-third is by the greater auricular nerve and the upper one-third is by the lesser occipital nerve. So these five nerves are involved in the nervous innervation of auricle. Now let's discuss what is the clinical importance of this anatomy, why it is important to know the anatomy. The first thing is the incisura terminalis. We have already seen that this incisura terminalis is the area of the pinna where the cartilage is absent. This is the area which lies between the tragus and the starting point of helix. Since this area is dehiscent or not there is no cartilage in this area, so it is a site for the end oral incisions while doing any mastoid or ear surgeries. Second is, if there is any collection of blood or pus between the perichondrium and cartilage, what will happen? If you remember, I already told that since the cartilage, it gets its supply or nutrition from its overlying perichondrium. So, if there is any collection of blood or pus between these two, what will happen? The perichondrium will be stripped off from the cartilage. This cartilage will not be getting any nutrition, and as a result, it may undergo necrosis. So, it may lead to complete necrosis of the cartilage, and sometimes certain deformities may develop, sometimes called cauliflower ear. These things we'll discuss in details in the diseases of external ear in our another video. Next is why ear is susceptible to frostbite. The reason is that since the subcutaneous layer is very minimum or very less in case of the skin, in cases of ear, it makes the blood vessels more susceptible to the frostbite. What is referred otalgia? Referred otalgia is patient they come to you with the earache but the cause is not in the ear. On examination, the ear is fine but the patient is complaining of ear. Then what to do in those cases and why it happens? It happens because the ear it is getting its nervous innervation from so many nerves, from fifth nerve, ninth nerve, 10th nerve, greater auricular nerve, lesser occipital nerve. So if on clinical examination in a patient with ear pain, if ear examination is normal, then we have to look for the conditions or look for conditions in the organs with the similar nerve innervation to rule out the primary cause. Thank you. This is all for this video.